Pain in the perineum is not something people talk about, and yet it can be very, very limiting. How to get rid of that perineal tension or pain is the subject of this video. Before we start, let's identify where your perineum is. So you have your external genitals in the front, so that's your vagina or your penis, and you have your anus in the back, and that space in between is the perineum. So a lot of times people have pain in that area, but the symptoms can be somewhere else. And so a lot of times they don't see the connection. And of course, down the road, then they're being told it's something else. They've lost the precious time, which is highly valuable in treating pelvic floor dysfunction. So if you have subscribed to the channel, you know the different presentations of pelvic floor dysfunction, and with the perineum being involved is one of those symptoms. If you haven't subscribed to the channel, make sure you do. And in that same channel, I talk about a series of videos. I've talked about that golf ball feeling in the perineum. That's a very common presentation that you may be relating to. I'm going to make sure that that goes at the end of this video, but make sure you subscribe to the channel because there's going to be a lot of other videos I've done that may be something that you can relate to. When it comes to perineum, engagement of your perineum, you're using your perineum for functions that are not the functions of your perineum. You're using it as a result of compensational patterns that you have established because you have dysfunctional patterns of movement as a result of pelvic instability. You see, when your pelvis is unstable, the muscles inside the pelvis behave differently. That's because you're unstable on the outside, and the inside and outside are to work together to stabilize the pelvis because your pelvis is the foundation to the structure above. When the stability on the outside is not happening, the inside muscles have to ramp up their action. They're going to tighten up, they're going to cause compensation. As a result of this compensation, you're not going to be using your body parts the same way. And so now, before long, you're pinching your perineum, you're contracting your perineum, you're pinching your anus, you're doing all of those, which should not happen at all when you're moving or when you're standing up, just standing, or when you're walking. If you feel you're pinching your anus or you're tightening your perineum, just when you do your random check, and you're doing it, you have pelvic floor dysfunction, which means you have compensation patterns, which means you are unstable in your movement patterns. That means no amount of injections, no amount of medications, no amount of stretching, no amount of strengthening are going to work because what's lacking is proper mechanics. That mechanics is not there. Listen, if you don't have proper mechanics, you don't have stable enough foundation to build strength over. You will have tension, therefore your attempts to stretch the area is not going to materialize because the feeder of the tension is still there. So instead, focus on understanding how to build that mechanics of movement, how to establish that foundation, which I use developmental exercises for. Developmental exercises are what we all did as babies to become running toddlers. No bands, no gyms, no weights. And yet, every single one of us were coordinating our movements enough. We were strong enough that when we could barely hold our heads up, we became running toddlers. Our parents were chasing after us. So these are the right patterns of movement because you and I, without knowing each other, we've done the same thing. Our brains are programmed to follow it. Our body parts are programmed to follow it. We are not making stuff up. We're just learning the glitches that can happen in that system that exist if you are having perineal tension and pain, as an example. If this makes sense to you, make sure you subscribe to my channel. Go ahead and check out my channel, search for your symptoms, see what other videos I've done. If you want to see more videos, comment below. I will do more videos depending on what's going on. If you're ready to tackle this for once and for all, use one of the methods of contact in the description box to contact me. You should own the solution to your problem of instability. So the sessions I have with my patients are all geared towards transferring that knowledge, more than just in theory, but in action, from me to you, so you become the guardian of what you're creating and you're safeguarding. Hope this made sense. Thanks for watching.